Hi, my name is Scott Wu. I'm here with Claire Fernandez and Dr. Abel to present our abstract promoting system-level healthcare change through pro bono community health consulting. We are from the Northwestern University Feinberg School of Medicine, and we thank the Diversity in Medicine Conference team for putting this together. Thank you. So, who we are is Second Opinions. That's the name of our student group and 501c3 nonprofit from Northwestern that provides pro bono consulting services to community health centers. Our goals are twofold. First, and most importantly, is to improve community health through the strategy work that we do. And we're going to get into that in just a second here. The next is to develop leaders in healthcare. And those leaders, we hope, are our fellow classmates here at Northwestern. And to do this, we do this by creating rich hands-on opportunities for our fellow classmates to improve the healthcare challenges that they see today. So we work through these four main principles or pillars. First, we pursue goal-oriented projects. So we're not on retainer. We like to have a clear objective outline before we start any work. Next, we do our 2 to 3 months of due diligence and collaboration. That relies a lot on the organizations we work with to provide contacts on their end, as well as information and data when and if needed. Our teams are comprised of roughly 4 to 6 medical students. That includes analysts, project leads, and partners, as well as expert advisors like Dr. Ko and numerous other faculty members at Northwestern and beyond that we work with and rely on. Last, like any great organization that does volunteer work or service work, we don't stop our work once that finite project is done. We like to follow up longitudinally, check in on how our recommendations are doing, and of course, just check in with the many great friends we make along the way at these organizations that we work with. So here's what an average project looks like. And it's going to vary from project to project depending on the need, but this is a pretty solid backbone of most projects. It includes upfront brainstorming and scoping whatever project we decide to pursue. That includes mapping out the timeline, deciding who we're going to work with, of course, and making sure that we're on the same page when it comes to objectives. Next, it's going to involve appointing a sponsor on their end. This is the organization or nonprofit's end that we work with. And that project sponsor is going to be someone that we can rely on to schedule meetings, provide information, connect us with anybody that we need to talk to. And they're a very, very important part of what we do. After we assemble that team of 4 to 6 Second Opinions members, we're going to have a kickoff that it gets everybody together that needs to be there. So our team, our advisors, their team, their contacts, any board members on their end that they'd like there. We're always very open to whoever wants to join on their end and like to keep things as transparent as possible. After that 2 to 3 month diligence process that you see there, we like to have a final presentation. And there are a number of midterm and check-in presentations along the way, but that final presentation and the deliverables that go along with that really caps off what we've done over the past 2 to 3 months. Like I mentioned earlier, we don't just end things there. We like to have a handoff where our recommendations are explained and detailed enough to where we can give them to members of the client staff and have them kind of take charge of it themselves through the implementation process. And then of course, we're there for feedback, check-ins, follow-ups. A lot of times we work with the same organization more than once. So we're not just seeing them for this given 2 to 3 month cycle, but we're seeing them next year and the year after. And there's a lot of check-in and just informal get-togethers, honestly, along the way, which is very heartwarming and nice for us as a project team. We've been very successful over the 6 to 7 years that we've been an organization. We've worked with more than 17 organizations now across 35 plus projects. You can see some of the logos of the organizations we've worked with here. We're very proud of the work we do. And as you can see on the left there, the work we do is not just confined to any one given strategy initiative. We work across the board. It can be something as qualitative as kind of market research or just getting expert opinions for a new program that an organization is implementing, or it can be something like modeling out quantitative data for workflow for healthcare economics or finance. So we like to really do the most we can with the most resources that we have. To cap things off here, our main conclusion is that medical students are capable of providing detailed and actionable healthcare strategy. And this strategy helps the same underrepresented patients, the same ones that we all hope to care for in our clinics and our hospitals. We as medical students are untapped resources, we're innovative thinkers, and we're of course eager contributors. We're here for the long run, not just in the clinic or the OR, but kind of outside the hospital too, trying to help these organizations that we love, trying to help these patients that we care for as much and as broadly as possible. So you can visit our website, or you can see a recent op-ed that we wrote with Modern Healthcare to learn more. And thank you for your time.